What is your name and where are you from?
My name is Colleen Gibson. I'm from Prince George, British Columbia, Canada.
What procedure did you have done and how long ago was it?
I had a 2-level disc replacement at the L4-5 and the L5-S1 with the Maverick disc on January 25th, 2008.
What was your pain level before surgery on a scale from 1 to 10, with 10 being the worst prior to surgery, and how is it now?
Prior to surgery, my pain scale was mostly a 10. For the last 5 years, with my last, what I call back attack, I never did recover from it, and the pain had gotten to the point where it couldn't be controlled with medications. I tried injections. Nothing was working. And when I came out of my surgery after my disc replacement, my pain was gone, and I have never experienced that pain again.
How would you rate your experience at our facility, 1 to 10?
My experience at the facility in Bremen, Germany was a 10. I couldn't have asked for better care. It was so clean. The food was excellent. The nurses were wonderful and friendly. Hans, the massage therapist, was probably the best I've ever seen. And I would recommend that hospital to anybody. I didn't get infection. I didn't have to have antibiotics. The operating room was top-notch, and I worked in an operating room all my life, so I knew a little bit about operating rooms, and when I went into their operating theater, I was blown away by the equipment and the cleanliness and the professionalism.
So you would say that you would recommend this surgery or facility to others?
I would recommend this surgery and facility to others, yes.
What procedure did your doctor in the USA or Canada recommend?
I went to see a neurosurgeon in Vancouver, and he recommended that I have fusion surgery if I wanted to. Otherwise, he would want me to wait for the chance of disc replacement surgery being available. But he said it would be 20 years, and I didn't have 20 years to wait. I could no longer walk anymore and could no longer take the pain. So he said we could do fusion or we could just wait. So I chose to do disc replacement in Germany.
How did you find out about the hospital in Germany and the team?
I got a phone call one day from a friend in Calgary, Alberta, who said, read your local newspaper. There's an article in there about a girl with the same back condition as yours. So I got my hands on the paper and I read it, and it was an article written in the Prince George Citizen called Back on Her Feet Again. And it was written about a girl named Lorinda Martin who had gone to Germany and had a 2-level disc replacement at the same levels as I had had with Dr. Ritter-Lang. I phoned her. We got together for coffee within a few hours, and she told me her whole experience and how wonderful it was and that she was doing fantastic. She's now running 20K marathons, which I think is incredible. I gathered my information. She told me where to send it, gave me all the contact information, and I sent it off.
What activities are you now able to do after recovering from surgery?
I'm able to do all the activities I always loved to do. I'm an avid hunter. I like to go quadding, fishing. I love to walk. I walk an hour every single day on country roads. What else do I like to do? I love to horseback ride, snowmobile. I'm very outdoorsy, and I can do everything that I ever wanted to do.
How important was physical therapy post-operative to your recovery?
Physical therapy is very important. It helped build my core muscles and strengthen my muscles after surgery, because you do go through a major operation and you have to rebuild. And since I wasn't able to do much before my surgery, my muscles had all weakened. And so I started attending physiotherapy, and I still do my exercises every day and walk regularly an hour a day.
So you're still doing your physical therapy as maintenance?
Yes, I am, and I will continue to do that. I feel staying strong and building your back muscles and core muscles is very important.
Has your surgical outcomes limited you in any way?
My surgical outcome has only made my life better. It's given me my life back. I can spend time with my family, my friends. I can travel. I can do absolutely everything I want to do without any restrictions.
So it's benefited you in more ways than just physical?
Yes, it has. Before surgery I was to the point of severe depression, and now I wouldn't even think twice about that. I'm so happy. I feel so fortunate, and I can't thank Dr. Ritter-Lang enough for what he's done for me.
I want to thank you so much for taking the time to do this video. Do I have your permission to post on YouTube for others to see?
Yes, you do.
This video will help others who are suffering and give them more confidence in making their decision to have reconstructive spine surgery.
Thank you.